Okay, welcome back. You all are in for a treat with this final closing keynote presentation. We wanted to leave you all with a really inspiring story of transformative change within a large institution. So this will be an exciting way to close us out for this year's Menus of Change. So please join me in welcoming Michael Kaufman back to the stage to introduce and moderate this final session.
Thank you, Allison. Little feedback. Well, welcome back, everybody, and I couldn't agree more with what Allison just said. This is a super exciting presentation, and it reflects an extraordinary achievement. And I hope as you think about change in your organization, I mean, after all, it is Menus of Change, and notwithstanding the wisdom of the provost of the CIA, change is hard, but change is what we need to do. And the change that you're about to hear about, the transformation that you're about to hear about, was led by somebody who figured out what levers to pull, push, in order to create that success within a massive organization. Northwell, as you will hear, has 25 hospitals, 85,000 employees. It's the largest private employer in New York State. So leading this effort, and the person who will tell you all about it, is Sven Gierlinger, who's the SVP Chief Experience Officer at Northwell. He previously actually was trained as a chef and then was affiliated with a luxury hotel group. So he brings this unique perspective to the patient experience in a hospital. It was his personal patient experience, he says, spending 3 months in hospitals, that motivated him to challenge the status quo in healthcare. And so, as Chief Experience Officer at Northwell, one of the largest hospital systems in the United States, he's driving cultural transformation grounded in patient-centeredness and empathy. And one area that he has passionately and aggressively pursued is the intersection of the patient experience and food. So please welcome Sven Gierlinger.
All right. Well, good afternoon, everybody. I'm so delighted and really excited to be here. When I first signed up or agreed to be speaking here, I didn't realize that it's going to be the closing keynote. So I thought, oh, they made a big mistake. So thank you for sticking around. I'll buy you a drink at the reception. How about that? But what I'm going to be talking about is, as it says here, our journey about our food transformation. And I'm not saying that we have found the secret sauce, so many puns in food, it's just awesome, or that this is works for everyone or is the right way to do it. It's our journey and what worked for us. Most importantly, what worked for our patients, who we are really looking to as being the ultimate arbiter of how well we're doing in this space. So let's see if this works here. So Northwell Health, like Michael just said, we are the largest health system in the state of New York. We span a pretty large geographic area from Staten Island all the way out to Peconic Bay and northern Westchester, and now actually into Connecticut. Lots of numbers up here on the screen. I definitely won't go through all of them, but just to make the point that the change that we've implemented is not just for one hospital or for a few hospitals. It's across the entire organization at every hospital. And I, as a Chief Experience Officer, obviously assess everything we do through the lens of the consumer, through the lens of the customer, the patient in our case. And I won't go through the whole strategy here, but the food fits into all of that. Most importantly, though, I view my job as the number one priority is to listen to the voice of the customers. And when it comes to food, the patients have, I think in general, very low expectations from hospitals, right? So they don't expect great food. For some reason, food has been, in hospitals, everything has been squeezed out of that. Everything has been sort of let's just do the bare minimum. At least that's what I've experienced, and it's certainly what I've seen in our organization. I didn't see any passion, any excellence going on in our kitchens, etc. And as we were diving into this and listened to it closer, at first I have to tell you I kind of ignored it. The first 2 years when I started, I've been at Northwell for 9 years because there was so much to work on. But then the complaint letters were piling up. Michael Dowling, our CEO, was getting more and more upset. He turns to me and he says, "You come from the food industry. Go ahead and fix it because I'm tired of all these complaint letters." And when we were digging deeper into our data and into the feedback from our patients, by the way, we get over 500,000 surveys a year, the comments about food were just horrendous. Patients were saying that the food was inedible most days, that the food was atrocious and unpalatable, not fit to feed my dog. Those are very strong words. They told us that the food was heavy on carbs, sauces, waterlogged, frozen vegetables, and sugars. Sounds like hospital food? Does, right? So also told us high on nutritionists. We have a lot of dietitians, by the way, working in hospitals. And the best advice they gave us is to hire chefs who know how to cook. So that's a concept that I found was actually a little bit foreign, at least in our organization. As we were going around, I didn't find many people that actually knew how to cook from scratch, but we'll go deeper into that. This is very poignant. Every meal brought to me was unappetizing. People need good food to get better. So food is healing. Patients have expectations around food because a hospital should be a place of healing, and food is part of that journey. We also realized that we were in the 9th percentile. So think about that. Low expectation to begin with. That means that 91% of U.S. hospitals were better than we were in terms of food. So the evidence kept just on piling up. I have to say, though, that not every hospital in the U.S. is actually measuring the quality of the food. They don't even ask the question about it. I think it's less than 50% of hospitals are actually asking that, which tells you something in and itself. At least we've been doing that for years, so we knew how bad we were. And we were serving well over 10 million meals a year, actually. We have over 1,000 employees dedicated to food services, including the dietitians, and a very sizable expense in food, if you add the food cost itself and the supply expenses to that. So, I look at this and I say, we're a pretty big food company, right? That would be a sizable organization. And how we approach that is as a team effort. So to bring together a collaborative team after Michael Dowling charged me with a change, and look at all the stakeholders that are part of that. So procurement obviously is a big part of that. What we purchase, what we bring into the organization, the operations at the various facilities that produce the food. Employee wellness and HR. So there was a big desire actually from our employee wellness team also to improve the quality and the healthy aspects of food in our cafeterias, because most of the customers in the cafeteria actually are our own employees, and you heard we have 84,000 of them. And our clinical partners, our nurses, particularly our physicians, etc. And what we found was what the food looked like, especially in terms of what we purchased and what we prepared, was this cook chill model. We had frozen food, canned food, fried food, lots of processed foods, and laden with preservatives, unappealing, prepackaged, pre-cooked food, lots of unhealthy ingredients. It always struck me as weird that the dietitians were so focused on, let's make sure that we don't put a gram of too much salt in it, or that we put all these restrictions on the food that we can actually serve to the patients. But then it was okay to have like tons of preservatives in the food, high fructose corn syrup in desserts that we were serving, and there were 600 calories, etc. And most importantly, a lack of leadership to drive change within that. So very early on, one of the first things we did actually is create what I call sort of a manifesto around food. As a healthcare organization, we should be leaders in that. We should be making sure that we teach our communities that food is health. Hippocrates said over 2,500 years ago, actually, let food be thy health and health be thy food. And so really talk about the positioning of food, not just improving the food in the hospitals that we serve, but to take a more global position around food and define what healthy choice means within that. Talk about the community aspects and tying that to the efforts around community health and the social determinants of health. Education through teaching within the facilities, outside of the facilities, and to impact some of the trends that are happening. To really think about Northwell Health as a healthcare organization, not as a sick care organization. Many people know the facts that are out there about obesity, about diabetes. Like 130 million people in this country are either pre-diabetic or are diagnosed with diabetes. Let that sink in. When I started in healthcare 15 years ago, that number was about 80 million people. So we've grown 50 million people now that got sicker as a result of the food that we're serving. And 90% could actually be affected through lifestyle changes, and especially through diet. But we also called out particularly chef excellence, to start in the kitchens, to start with having the right people that know what to do with food and to cook properly. And so we hired somebody who knows something about that. We were fortunate to hire Chef Bruno Tisson, who was a chef at the Plaza Hotel for 12 or 13 years, and then went on to the Sonoma Mission Inn with Fairmont, where he had a Michelin star. He was a game changer to come and join us. Now, we didn't put that in the job description, has to have a Michelin star. It just happened to be like that. And since then, we've gotten more extraordinarily talented chefs as a result of him joining. And we knew that we were on to something when the media picked up on it right away. Now, we haven't done much, to tell you the truth. We were like in the 30th percentile rank at that point. Maybe we made some improvements. But the New York Times covered us. NBC Nightly News did a national news piece on that and how transformational it is to hire somebody of that caliber into a healthcare organization. And this is some of the work that we've embarked on, especially under the leadership of Chef Bruno. Starting with the items we purchased. We had about 150 different chicken products that we were purchasing, all of them pre-processed. There was nothing, there were even the uncooked chicken breasts were frozen, and many other areas. So we cut that out and we locked that down and changed the model from frozen and pre-processed to fresh vegetables. Introduced a fresh bread program to have something more like what a restaurant does, to order fresh bread on a daily basis. We're working with two local bakeries, Amy's and Orwashers in New York City, to do that. So Bruno fostered those relationships, working with local bake shops to make desserts for us, actually, that meet our nutritional guidelines, under 250 calories, etc. Small portion, something beautiful that the patients can enjoy and not have the other desserts that I talked about earlier. Making sure that our offerings are culturally diverse. We ripped out all fryers out of all the kitchens. Now, I was joking at the time that a great business would have been to sell French fries out of the trunk in the parking lot, because the employees, they were a little bit in shock about that at first. But we set a date. Some hospitals actually had retirement parties and funerals for the fryers. Eat as much as you want. Next day it was gone. The fryer was in the dumpster, and then we moved on. Also removed about 80% of our sugar-added beverages within the organization. I wish we would have done 100%, but we're still on the journey, and we'll get there eventually. And looking at all of our proteins, first of all, introduce more plant-based choices for our patients, but then at least for the animal-based proteins, so that they're hormone and antibiotic-free, that they are humanly raised, that they that they're as local as possible, etc. So lots of work on the procurement side. But as it was said earlier in the panel, to produce food from fresh ingredients, you need a different level of talent that can actually execute that, because before you didn't need that. So Chef Bruno brought in two chefs immediately with him from the Sonoma Mission Inn. I don't know if anybody from Fairmont is here. I hope not, because they sent me a letter, a cease and desist letter, to stop hiring the people from the hotel. But I thought it was a pretty good sign that they followed from the West Coast to come to the East Coast to work in a hospital system. And that created sort of a groundswell, and then more chefs joined us. And now we have about every hospital has a new chef that came from the hotel or restaurant industry, and you see some of the institutions that they come from. We have a partnership here with the CIA, where we are an approved site for the externship program. Right now we have an extern at Northern Westchester, so they can choose to go into hospitals. At Northern Westchester, the chef, Andrew Kane, actually is a graduate from the Culinary Institute of America. He worked at the French Laundry. He was a chef at Santé, where he had a Michelin star. His caliber is just unbelievable, and that's what these young chefs who they're learning from. We also created a tuition forgiveness program, so up to $10,000 of tuition debt that our cooks have when they come out of culinary school. They stay with us for 3 years. We pay them that, so to give an additional incentive. I don't know of any other healthcare organization or even restaurant or hotel that does that. But the biggest why is there's a lot of advantages to work in healthcare. We have great working hours, so better quality of life. We have great benefits, job security, especially as a lot of employees were laid off during COVID. We were pretty busy, as you can imagine. So lots of advantages. We have our own career site for our food and nutrition staff, all the things that we had to build where there was no focus on that. I won't go through all of that, all of the details that we've done, but a lot of focus on training the staff and making sure that we just introduce new standards around that. One of the coolest thing we do every year, and Michael Kaufman was part of that one year, a few years ago when he joined us for that, is we do a chef's challenge, a cooking competition, where all the hospitals actually compete. And we get celebrity chefs there to judge. We had Lydia Bastianich last year. We had Chef David Burke this year. So our hospital cooks have to present their food to chefs like that, just like you see on a TV set. And Michael Dowling, our CEO, as generous as he is, not only does he make the time to be there and to recognize the chefs and the excellence that they put forward, he also said, let's give them something that's worth it when they win this challenge. So this year, 2023 winners, it was Northern Westchester Hospital, 4 people on the team. They each get to bring a guest and go to Napa Valley for 3 nights airfare, hotel paid for, with a visit to the Culinary Institute, actually, in Napa Valley as well, which is, you should have seen them celebrate. They celebrated like they won the Oscars. It was pretty awesome. Won't talk too much about dietitians, but dietitians are a very important component. The problem was that in the past, the dietitians actually ran the kitchens, but they never ran food service operations. They decided on the dishes. They decided on operational things that they really didn't know much about. Now the dietitians are really focused on advising, working with the chefs, coming up with new ideas, working with the patients, spending more time with the patients, actually, and talking through the choices that they can have instead of just printing everything on a different menu. And we also had appointed somebody to lead the dietitian effort. Teaching kitchens, we're actually building a teaching kitchen, bricks and mortar, as part of our Center for Learning and Innovation, which we're very excited about. We've been doing the pop-up teaching kitchens in our hospital cafeterias, but also in our communities, as I said earlier, to tie that to our social determinants of health, and we are a member of the Teaching Kitchen Collaborative. We're forming a relationship with farms. Queens County Farm, which is right behind one of our hospitals, Long Island Jewish Medical Center, 47-acre farm, where we are now in the process of procuring food from them, but also tie some of our programs to what they do as well. And Harlem Grown, an amazing institution in Harlem that is about teaching kids and impacting young people from underserved communities, et cetera, and a big focus on sustainability and making sure that we do well by the planet, which has been the focus of this conference. Today, we are sitting, every time we put the slide up, we have to update it. I think it says 82%. It's actually 84th percentile. So we went from the 9th to the 84th percentile in 6 years. And but it's not about the numbers to me. While this is obviously measuring our progress and how well we're doing, this is what excites me, is what our patients are saying now. You saw the comments before. But now they're saying that they were thrilled with everything they're getting, that they forgot about the pain, that they forgot about that they were in the hospital, that it feels more like a restaurant food, that they can't believe that the food is so fantastic. And now I'm going to share with you a quick video so that you can see for yourself.
What is it about hospital food? How can we demand the most advanced, curated treatments, but never question that lifeless fare served 3 times a day? Even the school lunch lady would be appalled. Yet here we are, with meals that are more bland than beneficial. But could hospital food be something, I don't know, actually appetizing? So what in the name of green Jell-O happened?
Yeah, that's the question, is why it doesn't have to be. I mean, mostly it's always that it's frozen, it's not fresh, there isn't attention to detail. It's really handled as a second thought.
You traditionally got lots and lots of complaints about food in hospital settings. I know I've received quite a lot over the years about the need to improve.
Hospital administrators have looked at food not as a benefit to the patient. They looked at it purely as a number on the balance sheet, as a cost, really. And we had one leader who said, no, our food is good here at this hospital. I said, well, if you think the food is adequate, how about you eat the food with your leadership team? So they decided to order off the patient menu for 1 week. It was brought to the executive suite and they were eating the food. After day 2, I believe, they got it and they said, we can't eat that.
And that's when things really got interesting.
Prior to 2017, our scores were probably in like the 16th percentile nationally, so they weren't very good. And I could tell you because I was there and the food was not that great.
We needed somebody who was passionate about food, who can be a role model that all of the culinarians within the organization actually look up to, who can teach, and also who can bring in talent that is different from what we're used to in healthcare.
Enter Chef Bruno Tesson, Michelin-starred chef and the change agent Northwell needed.
After 40 years of being in the hotel restaurant business, I wanted to do something different. All my life, I worked for people who could afford my food, expensive food. Today, I'd like to give back to the community and I'd like to impact people's life.
And as soon as he arrived, everything immediately changed. Well, not exactly.
When Bruno first started, he used to come back from the site visit, so when he spent the day at a hospital, and he said, it's terrible. We have a long way to go.
The chefs were not really passionate or focused on what they were doing, and the food just didn't look very attractive either. There was food from 2012 in our freezers. We were buying pre-cooked frozen hamburgers, pre-cooked frozen fish. The chefs were not really cooking. I think the best tools in the kitchen were a can opener and a pair of scissors.
Most of the food we bought was processed, unhealthy ingredients, high fat, saturated fat. A lot of food was actually fried. We decided to make a big move and to rip out all of our fryers.
We have converted our freezers into refrigerated space. We start cooking with fresh food. We basically have brought the restaurant philosophy to healthcare. I call it farm to your bed instead of farm to table.
It takes a different type of talent to actually prepare fresh food with whole ingredients. It takes a different skill level.
I didn't want to hire a chef who had a healthcare background. I looked at resumes of chefs that work in the hotel restaurant industry, who worked in the best hotels and restaurants in the world or in the United States.
When I sat down with Chef Bruno during the hiring process, I said to him, I would like to do something where I can make a difference, where I could try and change with what I can do. He said that's exactly what we're looking for. We're looking for new chefs to come in with the skills of branding places and restaurants and hotel, that mentality, and try and bring that philosophy here to Northwell Health.
At the beginning, when I would do my visit in the kitchen, I could see that there was a little bit of hostility. And then a few weeks later, after changing a few things, I could see that the staff was embracing what we were doing.
He kind of watched. He didn't come in, changing everything right away. He went to every hospital, saw what they were doing. What he liked, he had them fix and perfect a little bit. It was definitely nerve-wracking. You start to know him and you start to realize that his only goal is just to make everything better. He just wants the best for the patients, which honestly, if you want to be here, that's what you want.
Where are the rolls coming from?
Those come from Amy's Bakery.
Amy's Bakery. Fantastic. Well, gentlemen, great job. Keep it up. Maybe the next time the sweet potato, make it a nice canal with 2 spoons instead of just laying out like that. And that's perfect like that. Great job, Stuart. Thank you.
It doesn't have to be terrible. It just doesn't, right? Like, there's no reason why somebody can't cook the same meal in a restaurant or a hotel, wherever you go, right? A stove's a stove, an oven's an oven. Why can you not make the same meal anywhere? There's no reason it can't be done.
Patients are in the hospital, they're sick, they have specialized diets. Being a dietitian myself, it's been really rewarding to be able to have input on what the recipes are going to be, and working with the chefs and finding unique ways to reduce sodium content, maybe reduce sugar content, things like that. The patients all receive a menu when they come in, and that menu is a room service menu. It looks just like a restaurant menu. Pick whatever you want on that menu from 7 a.m. to 7 p.m.
Any patient request, regardless of the diet, we've told all staff members, and everyone knows that it's our mission, whatever it is, we've got a refrigerator full of food. We can do anything.
In that case, Chef Bill, I'll take the rack of lamb.
I've worked in hotels, country clubs, unlike working at a restaurant where you can just throw butter, cream, and salt to flavor everything. In a hospital, you couldn't do it. So I actually was able to create my own menu. because they wanted to have a real chef and real food made from scratch.
Here at LIJ, we are the largest culinary facility in Northwell. We average around 5,000 patient meals a day. We encompass 4 hospitals. On any given day, we're between 1,200 and 1,400 patients, our census. So we cook it all day, every day, and it's fantastic.
Patients have very little control when they're in the hospital. And if there's something that can brighten their day, give them a smile, share with a family member, that can change a day, that can change an outcome.
I knew it was going to be different when I saw the menu because it had everything that I was looking for. I really felt like I was in a gourmet restaurant, and that's why I wrote a letter. You feel like the people are there for you, that they care about you. They want your experience to be as good as possible, especially due to the circumstances.
It's very rewarding when you hear the people say that, I feel like I'm in a hotel, because that's what we want.
Very much like in a restaurant, when a table asks for the chef to come out and to thank them how great it was. That's what's happening now. In addition to that, the chefs are actually rounding on the patients as part of their regular routine to check in with them and to get feedback, to see how things are going and what they can do to improve the food, which makes a huge difference also for our patients.
Is that your first meal here, or did you have dinner last night too?
No, I had dinner last night. The lamb chops was cooked perfectly. Well, this hospital here, to be honest with you, and the food here has been phenomenal. This is not hospital food.
We had one letter that said, this is the best salmon burger that I've had in New York City. Anywhere in New York City was the best salmon burger.
And as the meals improved, the patient satisfaction scores for food quickly followed, going from 7th percentile to 75th. And for 7 Northwell hospitals, these scores are in the top 10% nationally. All this while dramatically decreasing food waste and not increasing cost.
It's about changing not only the food, but changing the culture, the food and nutrition culture in healthcare. I think that if you're committed and if you put the means behind it, everything is possible.
We're improving the health and the wellness of the people and the communities we serve. The food plays a big role in it, and that makes me happy.
Food is health. It's important. It's been one of those things that we've done that has made us distinctive, and we should be very, very proud indeed.
So, what are we to think about this incredible journey to improve the hospital food experience? What we learned is that it's not just about improving the quality of food. It goes much further. Food actually helps people heal, and that's what it's all about.
Come in. Hello, Chef.
How are you?
I'm great, thank
Russ.
you.
I'm the Bruno.
Hi, your team is phenomenal. Been to the Plaza. Your French toast, as good as the Plaza. Your pot roast, everything. The cheesecake. This is the best hospital. I don't mind being in the hospital this time. I just can't get over how wonderful everything has been.
Thank you. You have my name and number on there if you have any issues.
No, I'll call you Saturday night when I want dinner.
So the biggest problem we have now is that patients don't want to leave, actually, and it's the truth. So we have to now make care packages, basically package the food for the patients because they say, I want to stay through lunch, but we need to get them out because we have a lot of patients in the emergency room that we need to get upstairs. So, but those are in the category of great problems to have. And just to wrap this up, I'm going to get over this. Now we have a whole new wave of media exposure, actually. The national news media is picking up on it. A Washington Post reporter spent 2.5 days with us and did a review of our hospital food and did a 2.5-page coverage in the food section of the Washington Post. I invite you to look at that. People magazine did a 2-page feature on Chef Bruno. He said he's never gotten more media. He's gotten more media in the hospital role than he has at the Plaza Hotel, actually. And so this is just, a validation, I think, of the importance that it is and the role that it plays for our patients. I'm not going to go through all of that. I think one of the biggest things, what's next, is to focus more on plant-based, plant-forward. This video is about a year and a half old, actually. So you see a lot of animal products in there, which we've already have been cutting back, and we'll do more of that. And I think I covered many of the other areas already here. But one thing is that the picture you see up on the right, that was at our patient experience conference with 700 people in the room, where we paraded our chefs up on the stage, and they got a standing ovation from the entire room. Many physicians, many top administrators in the organization, they've never gotten an applause like that in the past. And usually cooks in the hospitals are looked down upon, and I think what I'm most proud of is that we elevated the standard and elevated the role that chefs play and the culinary and nutrition staff play in hospitals. So thank you.
Well done. Thank you, Sven. Why don't we sit over there? We have some questions coming in. If you have questions for Sven, we have a few minutes to chat, and love to get your thoughts and your questions. So let me fire away. The first question that came in is, as you hired new skilled and experienced executive chefs, how difficult was it to manage the chefs who were cooks who had been there, and how did you help them, or perhaps conclude that they're not right for you?
Yeah, so it's a great question, and I think obviously that didn't happen overnight. It happened gradually, and as I said earlier, Chef Bruno brought a few chefs, it set a tone and set a new expectation, I think, to the rest of the chefs and the culinarians in the organization, that we're upping the game. And so many of them stepped up to the plate, and they were very, very receptive to learning, like you heard from Russ here, one of them, who's still with us. He's actually a CAA graduate as well. And but over time, there were some that they just didn't have what it took to get to that level. They either self-selected out, or in very rare cases did we have to help them find opportunities somewhere else. And but as I said, now it's not just the executive chefs; it's also the next layer down. So we have sous chefs, we have chef de parties, et cetera, that come from hotels, line cooks, and they feel very fulfilled in what they do and the creativity that they bring to the job.
Question is, has any research been done that shows positive outcomes on improving the health of patients as a result of this change? Perhaps shorter time spent in the hospital or other metrics?
Yeah, it's hard to do that. It's been a desire of ours, definitely, to do that. Not formally. I think a lot of it is anecdotal evidence, or the evidence we see from a patient satisfaction perspective, and the feedback that the self-reported outcomes of patients saying that it helped them heal better and faster. But that's something that we need to still do as well.
And Abby Chen, who just graduated from Harvard Business School, was a student in my class, so asks, of course, as a business student, or former business student, an alum, can you explain the economics of making the turnaround?
So I was expecting that question. That's why I didn't put it into my talk. So thanks, Abby, for asking that. There was a quick mention in that we did not make big investments to do that. I think that the biggest investment was probably bringing Chef Bruno on, but we created that position anyway because we didn't have anybody in charge of a $54 million enterprise. So we needed to have somebody to do that. And then we just, as I said, got lucky, I think, to get the Chef Bruno. We did pay more for the executive chefs that we were attracting just to be competitive with the restaurants. But we also found a lot of savings through that. Lots of waste in the organization, lots of food being thrown out that is not being thrown out anymore. So in terms of, if you look at the labor cost, we didn't hire an extra person except Bruno, so we didn't increase our FTE counts. Our food cost actually stayed within the normal increases for inflation. So year over year, it was probably 2%. Now, obviously, now it's a little different story, but we would have had the same food increases if it was still the old model with processed foods. So that went up, I think, by 5% or 6% now. But we are looking at that and seeing how we can mitigate some of that cost. But by and large, we didn't increase expenses, and we cooked much better food with the same equipment that we had. Problem was that in some kitchens, and that shows how neglected I think kitchens in hospitals often are, we couldn't get the parts anymore because of how old the stoves were. And so that's something that in previous days, probably administrators would have said, rip it out and buy more processed foods, and we replaced it. So there's natural capital expenses, I think, that came with it. I hope that explains the question.
And were other, you talked about the removal of the fryers, but were other capital equipment facility changes necessary, capital expenditures to ensure and enable more high-quality scratch cooking?
I think tray line changes from more of a production line to more of a room service line, but in many cases it was really just like reorienting how that worked. Buying some carts to do room service, but we did all of that within the existing capital projects of the hospitals, and really left that to the abilities and constraints within the CFOs of the hospitals. But I think the importance is that the impact that is having now, that our administrators saw the difference and saw the change. And what we've done is that we changed food from, and that's the title of our talk often, is food from liability to an asset. I quickly realized that in healthcare, food is really just a number on the balance sheet, and let's see if we can squeeze out another few pennies out of that. But we, as I said, did that within the limitations. One example I give you, which was mind-blowing, we served the most awful coffee that you can imagine. Most hospitals, you know what they do? It's like instant coffee, or like this it's not even powder, it's like a paste that they mix into water, heat it up and send it up to the floor. It's awful, you can't drink it. And we worked with the coffee company, put coffee machines in, long-term contracts, buying the coffee from them. Now we have fresh ground, fresh brewed coffee at a much higher quality, obviously, and we're saving $250,000 across the organization as a result of that. So that $250,000, then we reinvest back in to buy maybe products that were a little bit higher as a result of that. But also, fresh is actually, fresh ingredients are cheaper than prepared foods, but you need the talent to turn it into food.
So as we are winding up here, Sen, so you are a C-level executive, and therefore you can make change happen. But if you were somebody perhaps in the audience who is not C-level but wants to make this change, wants to inspire it, wants to help enable it, what advice would you give them?
To be persistent, to be the champion, because if you don't do it, nobody else will do it for you. And try to use evidence such as this, actually, that's why we're doing this, that's why we're sharing it with the world, because I think that the days of bad hospital food should be over. I think in 10 to 20 years, people should think of hospital food as nutritious, fresh, well-prepared, good tasting, and just tell your CEO it's a trend and we have to follow along with it. Luckily, we have a CEO who really believes that, but he also said, when I hired Bruno, and I said, here's who I want to hire, and he said, what the H, fill in the blank, why would he want to join a healthcare organization? Because he wants to give back, I think, and he wants to make a difference, and find people to share your vision also, to do that.
Well, you've made a huge difference for thousands and thousands of patients, and I think this will inspire hospitals across the country and the rest of us to think about making change and how to get it done. So thank you so much for joining us today.
Thank you for having me.
As we transition to the wrap-up, I wanted to build for a moment on Sven's presentation, just that incredible story and the power of collaboration and partnerships. We really wanted to feature this healthcare story, knowing that we work a lot with different healthcare organizations. We also partner closely with Healthcare Without Harm, who, for those of you who were in the breakout session with John Stoddard from Healthcare Without Harm, who is here, we've worked with them over the last several years to launch their healthcare culinary recipe contest. So this is now in its 5th year, and the last year's winner was from University of Wisconsin Health, and they have someone that was able to attend Menus of Change this year. So the winning recipe gets all the entries of the recipes gets judged by a team of us here at the CIA and also by a group at Johnson & Wales. And then the final winner gets complimentary registration to both the Healthcare Without Harm's Clean Med Conference and also Menus of Change with some additional travel support to be here. So we have the winner from last year, University of Wisconsin Health, and this current year's winner was Stanford Health. They were not able to be here, but just wanted to take a moment from the main stage to congratulate Chef Joe Morano and his team at Stanford Health for their winning recipe of a spicy lentils dish with honey walnut cauliflower. So just encourage all of you who might be part of healthcare organizations to look out for that recipe contest that gets announced each fall. And also wanted to give a shout out because as a result of Sven's participation in Menus of Change, it was sort of the impetus to get Northwell to officially sign up for the Cool Food Pledge just this week. So yeah. That's really huge, and John had shared that the current cohort of Cool Food members in healthcare, I think, is about 80 million meals, if I'm getting that right. But with the addition of 10 million meals just from Northwell alone, it's just a huge growth. So we're really thrilled to partner with WRI, with Healthcare Without Harm, with other organizations that you've heard that have been here today throughout the last couple days. Just to further emphasize that we need more of us working faster, going farther together to really combat some of these enormous challenges. So we have reached the end of this year's summit, and before I close us out, I wanted to bring back to the stage Dr. Walter Willett and Siobhan Hansen, who are going to share some of their closing remarks and reflections. So Walter and Siobhan, come on out.
Well, thank you. That was truly an inspiring presentation from Northwell Hospital. And I must say, I've driven past the French Laundry, I don't know how many times out in Napa Valley, and never could afford to go there. And so I almost feel like I need to go break my leg or something to get into Northwell Hospital and have some of that really tremendous food there. But it was, in fact, really remarkable because I've been in the healthcare world for almost 50 years now, and truly the healthy food in our institutions has been missing until very recently, when some people are doing some amazing creative things. And this is both for the patients, but also really for our staff. And I was glad to hear that that part of the picture was not omitted as well, because you just walk into a hospital and everybody's stressed and they're eating, in most places, terrible food and drinking terrible beverages. So we really do need to pay attention to our nurses, our healthcare aides, everybody, physicians. In general, their diets are not very good at the work sites, at least. So that really was inspirational. And that was just one of many inspirational presentations I heard here. I'm sure you are, most of you will probably be going out and having more bivalves. I've been watching this for a couple of years, and we are eating a lot more mussels now than I ever imagined I would be eating, and they're frozen, which is fine for getting frozen seafood. Basically produced in a very sustainable way in Prince Edward Island, where we happen to get them, and it's very affordable way to addition to almost every kind of meal you could imagine. So that's been wonderful. Yeah, but I'm sure you all have your own takeaways, and both for your personal ways of eating, preparing food, and also tremendous ideas how to change the places where you work. And to me, that's really inspirational, because it's easy to be depressed a bit about the state of where we are headed, and especially in younger generations. Just yesterday, the headline in Harvard Gazette was that climate anxiety is affecting 60% of college-age students, and 50% say it's interfering with their daily life. And one of the few ways that it's been found to help with that anxiety, and they should be anxious for good reasons, but not paralyzed because of that. And one of the few ways is to be engaged, and there's perhaps the most direct way to become engaged is through what we eat, and learning how to change our institutions so that they do provide more sustainable, more healthy food. I just did want to add one, it's a little bit of a diversion, but one comment is that clearly we can't control climate change or limit damage of other kinds that is occurring in our ecological systems just by food alone. We can't totally eat ourselves out of this problem. So we also have to eliminate fossil fuel use as quickly as we can. And just in terms of balance, I think it's important that we keep that in mind too. We need to be switching to electric cars, getting heat pumps. I'm negotiating with that right at the moment with our home, looking at where our work sites, how we conserve energy and keep those cool or warm depending on what the needs are at that moment. So again, those are just things to keep an eye on as our focus is food. That's where we have a special voice and special leverage, but we need to look at the other part of the picture as well. So just very briefly, I again want to thank everyone who came. This is truly an inspiration, with not just feeling inspired, but going away with a lot of practical things we can take to our individual lives and our institutions. And hope to see you again here next year. Thanks.
So thanks, Walter. A few reflections from my side. I want to reflect back on how we started. Walter's opening remarks, he mentioned that the CIA Menus of Change is the biggest translational exercise that his team engages with each year. And he framed the opportunity for us to be translational agents. I would say that's a pretty awesome purpose statement, to be translational agents to improve the health and well-being of people on the planet. So I want to encourage us to think about owning that. And the things that you've learned today, small or large, taking steps is a very important part of contributing to the solution. You know, it's going to be a great meeting when you've got Danny Nierenberg moderating a session on the landscape of scientific, political, social, and operational forces at play that are driving change and shaping business challenges and opportunities for our industry and the U.S. globally. Danny is not afraid of a hard question, and it was really fun to see her on stage, see her in the breakout session, and get so engaged with all of us. I was inspired by the conversation from Smith's Dining team at Harvard, along with Walter, to learn how they've created a forum for discussion focused on key pillars like health, culture, and environment. I admire how they've taken this interdisciplinary approach and that they are inclusive by design. Who would have thought that a plant-positive destination could come from the law school? Great job on creating unique intersections. Karen Watson from Kinetic Leaders gave us pointers on effective approaches for changing human behavior. I loved her 3 points. 1, understand the segment of the population we're focused on and reach them where they live. Use their language and through their channels. Number 2, make messages memorable, actionable, and achievable, and use a gain frame and emphasize community. Marie from Data Essential brought us great insights and data points from the 4th annual Plant Forward Opportunity Report. This new report can be accessed on the MOC website. Make sure you all access it and pour through it. It's a great action coming out of the conference. One insight that got me excited is that over half of the population is open to a plant-forward eating pattern. People are becoming more open to this style of eating, so I think we're making good progress. Sophie and Barton shared that now is the time for aquatic foods. Seafood is the key to climate solutions to help meet the SDGs, and aquatic foods connect tradition and innovation. Who could not be inspired by Barton's approach to engaging with seafood? And there's another action, eataquaticfoods.org, to access more materials and actions you can take in this space. Today, a shout out to Anne from WRI and the Cool Food team, 70 partners in 25 countries representing 8 billion meals yearly. These leaders are driving strong progress, but there is so much more to do. A plug for their playbook that Anne put up on the slide today, a playbook for guiding diners toward plant-rich dishes and food service. Proven behavior change strategies, which we know work. Google uses these strategies every day. We've learned a lot from this team, and I encourage you to access them. I love the session on building a better burger. This session helped us to reflect on the impact of small changes, all of us can make them, on menus that can make a huge impact. I appreciated the inspiring work led by the Healthy Menus R&D Collaborative, along with Fior, Matt, and Spike, and their individual stories on making a better burger with differentiated ingredients and improving this iconic menu offering. We can use the burger to democratize healthy and sustainable eating. Peter, thank you for sharing your personal story and how it has led you to make a difference in your world of business, financial investments, and the market to solve challenges in the food system. To Bryce and the Every Table team, we are cheering for you, and for your success with your trailblazing venture across the U.S. And Sven's story from Northwell is one more amazing success story of turning hospital food from a liability to an asset. I love that framing. It's a great way to close our time together. We all had delicious food experiences, saw old friends and colleagues, and met new ones. I certainly did, and I can't wait to connect with those new friends and see what we can explore together in the year ahead. Thanks to the CIA team, to Rupa and Allison in particular, for your innovative and sharpened focus, changing the conference, adjusting it to a tighter 2-day schedule, for what our translational agents need to be better in their roles in this very complex environment. We look forward to ways that you will bring us together for more learning, deeper connections, and building new partnerships so that we can keep driving solutions to deliver health and people, to deliver health for people and the planet. Thank you.
Beautiful reflection, Siobhan, and thank you, Walter. Just a couple final closing remarks from me, and I really encourage you, just the exercise that Siobhan just shared with us is a beautiful narrative. I encourage you each to take some time to write your own reflection, summarize your own notes. One way you can do that, or as part of that closing the loop on your full experience here, is to complete this short evaluation form. Not only is this feedback incredibly valuable to us, but it does help, again, close that loop, give you a chance to reflect on what you learned, what you'll be taking away, what you would like to see in future years, so we can continue to make this a better experience for everyone. One final reminder to complete the polls in the app by tomorrow to be entered to win a free registration to any CIA conference in 2024. We have all the resources available at Menus of Change. You'll have access to the app for some few weeks following the conference, but all of the resources will be on the app for extended period of time. So that will be the place you want to look for in the future, and bookmark that so you know where to go to access all of the great materials, resources, recordings, recipes, etc. Here's information for claiming continuing education credits, and we'll also be sending this information out in a post-conference email that you'll be getting later today or tomorrow. And I'd like to give one last thank you to all of our advisors on the Scientific and Technical Advisory Council, chaired by Dr. Walter Willett, and our Business Leadership Council, chaired by Siobhan Hansen and Michael Kaufman. A lot of these individuals have been longtime friends of the CIA, have been part of this initiative since its inception, and we're just really grateful for all of the guidance and wisdom that they share with us. Of course, none of this would be possible without the support of our grantor, Toast.org, our platinum sponsor, Oatly, our gold sponsors, our bronze sponsors, our supporting sponsors, our corporate sponsors, and our media sponsor, Nation Restaurants News, and our research collaborator, Data Central. And of course, really our entire CIA team for making all of this magic happen. We have an incredible staff here based in Hyde Park, and also a whole contingency of folks who fly out from California to be here and just make all of this possible with such professionalism and hard work and dedication and kindness and fun. So please join me giving a round of applause for our amazing CIA team that pulls this all off. And we hope that you will stay connected to us via social media, that you'll stay connected to one another, that you'll join us at our other events throughout the year. This includes our 25th anniversary edition of the Worlds of Flavor Conference and Festival on November 8th through the 10th. Registration is now open, and you can use the promo code WOOF for 15% off. And you can also save the date for our Global Plant Forward Culinary Summit that takes place also at our CIA at Copia campus in Napa on April 16th through the 18th in 2024. Registration for that will be opening later this summer. And of course, we hope you'll join us back here next year for what will be the 12th annual Menus of Change Summit on June 12th through the 13th. So mark your calendars now. So with that, I will just thank you all again personally for spending your last 2 days with us, really just actively participating, engaging with the conference sessions, with the presenters, with one another. We need you. We need each of you to work together for the collective better food future for us all. And we hope that you will lean into this community of fellow change makers as you go off into your journeys. So take care of yourselves, take care of each other, and we hope that you'll join us out in the plaza now just for one final celebratory toast as we send you all off. So take care, be well. Thanks, everybody.